consequences of normal aging, starting from the central nervous system. An older person has an increased risk of delirium, which is the fluctuating level of consciousness. Delirium, and that is acute fluctuating loss of consciousness. And obviously there is abnormal cognitive abilities, that is delirium. And this increased risk occurs due to increased loss of the neurons. So the neuron number with age diminishes. That is the cause of high risk of delirium. There is also presbyacousis. And presby means related to the older age, and acousis is hearing. So there is diminished hearing related to the older age, and that is mainly a high frequency hearing loss due to degeneration of the inner ear, that is known as the cochlea. There is also presbyopia, which is the diminished vision. Presbyopia, diminished vision, due to the decreased elasticity or increased rigidity of the lens. The lens become less elastic and more rigid, and that leads to poor near vision, that is the presbyopia. The lens also degenerates and the opacification of lens increases. That also leads to a poor vision or cataract due to the opacification of the lens. The patient's muscle become weaker and the patient has increased risk of fall. Weakness of muscle are related to the decrease in the number of the anterior horn cell. So anterior horn cell number decreases. Those anterior horn cells typically innervates the muscles, and that leads to muscular weakness. And there is increased risk of fall. And the reason is the patient has a diminished proprioception and vibration sense due to a decrease in the cells or cell numbers in the dorsal column. That leads to increased risk of fall. Now come to the respiratory system. In the respiratory system, the older person has a reduced vital capacity and the reduced peak expiratory flow, because the patient usually has an increased rigidity of the chest wall, and that diminishes the movement, rigidity of the chest wall. The person usually, older person usually has a high residual volume because of reduction in the lung elasticity. There is increased VQ mismatch in an older person, and that's related to the reduced saturation in the partial pressure of oxygen in the pulse oximetry. And the older person has an increased risk of infection such as pneumonia, and that's related to the reduction in the calf reflex. The calf reflex becomes weaker, and reduction in the ciliary beat, which helps to clear up the mucus and the darts from the respiratory epithelium. So decreased calf reflex and decreased ciliary activity, leading to an increased risk of pneumonia. Now let's come to the cardiovascular system. Usually the patient has a reduced exercise tolerance, and that's related to the mechanical and the rate-related function of the heart. Usually with aging, the heart rate becomes lower. So the patient cannot increase cardiac output in response to exercise. And that's why the exercise tolerance reduces. There is also on clinical examination a widening of the pulse pressure, widened pulse pressure, and that is related with the high systolic blood pressure due to the arterial rigidity. Arteries become rigid, and that increases the systolic blood pressure, and that increases the pulse pressure. And the reduced elasticity of the blood vessels leads to an increased risk of postural hypotension. Increased risk of postural hypotension, and that's due to reduced elasticity of conduit and capacitance vessels. The capacitance vessel has a reduced elasticity in older age, and that leads to high risk of postural hypotension. In the GI system, older person typically experiences constipation, and that's related to the reduced motility of the gut. The gut becomes slow, and that leads to constipation. In the renal system, the patient usually have a reduced GFR, and that increases the risk of fluid imbalances, especially increase the risk of fluid overload if the patient drinks excessively. And there is reduction in the tubular function. So if someone doesn't drink much, if someone is very dehydrated, there is high risk of kidney injury. The patient is very sensitive to dehydration. So the both end of the spectrum, the patient is in high risk of fluid overload, and the patient is also in a high risk of dehydration. So we have to be very careful with fluid therapy in older patients. Don't give too low, don't give too high. Both can be detrimental. So those are the classic changes that we can see in a patient who is older. Those are the clinical consequences of normal aging.